Tell me about your work in care homes.
So in our area in North Sedgemoor, we have quite a large care home population, older adults and adults with learning difficulties. And I think a big part of our job is upskilling staff. Staff work shift patterns, so there's quite a lot of changes within the care home, and it's supporting individual staff members to upskill other staff in the homes with how best to support that resident, be it with moving and handling, encouraging them to move in the home, or encouraging what the person would like to do. So when we've gone and done a holistic assessment and we've found out information about that resident, that they like to cycle, or they like to do flower arranging, or they just enjoy being out on the seafront, we've chatted with staff about how to support that resident to be able to do those things. And if there's some complex moving and handling needs, we've upskilled that staff member or staff members to be able to support that resident to engage in that activity.
Yeah, and then going on, obviously that's our area, isn't it, at the moment within care homes. But like we were talking about, our other primary care occupational therapists across the whole of Somerset, we're working in slightly different areas under the Direct Enhance scheme, which is around, we've got health inequalities in there. So some of our OTs within that are now working with people who are homeless or are refugees, and how they're being integrated into society and things that might be affecting their mental health, but also their physical health, and accessing GPs. You know, we need to learn, don't we, that actually sometimes it's us that might have it wrong, and actually it's getting it accessible to the person so that they can come to the GP surgery. But also it's around knowing what else is out there in the community. So within health and equality work, a lot of it is around working with our joint partners, so social enterprises, voluntary sectors, just so that that person knows what's out there and can help themselves with their own health and their well-being needs. Who else have we got in our teams?
We've also work with anticipatory care. As I said before, we use Brave AI to identify our residents. A couple of the other OTs are working in anticipatory care, focusing predominantly on adults in their 50s, looking at their health conditions presently to see how they can help them to help themselves as they get older, to hopefully reduce their risk of admission in future and to live better with their health conditions.
And it's also around the caring side, isn't it? So I think within an anticipatory care, a lot of it is around when you are a carer yourself for somebody, and how you may not have wanted at that time to have a carer's assessment through adult social services, but actually your life is becoming a little bit more strained, and maybe you need a little bit of support yourself and for your own wellness, but also to enable you to support your loved one. And I think that's where in anticipatory care OTs are being really utilised now in that area. And another good area that we're looking into as well is supporting women with wellness clinics and around the menopause, and how we know as women that can affect all areas of our lives, from our own wellness to being able to remember things, to be able to actually function in work, to potentially changing the environment, or just making our employer aware of what we might need so that we can continue doing what we love and have our jobs, but also manage our families. So, you know, our OTs are starting to get involved in those areas. So, yeah, like our clinical director, Kyle, was saying before in a previous video, it's all about making use of all our professionals for the person so they get the right care at the right time and with the right professional.